On March 1, 2012, top elected officials from the state of Maryland joined with University System of Maryland Chancellor Britt Kerwin, with Wallace Lowe, President of the University of Maryland, and Jay Perman, President of University of Maryland, Baltimore, to announce an ambitious partnership called MPowering the State.
These two academic research powerhouses have complementary strengths, and these strengths are in areas of great need by our state and the nation.
It is the responsibility of the university, the ivory tower, that comes up with great ideas in all sorts of fields, to translate those ideas into impact.
University of Maryland students will benefit greatly under this new plan.
In one short year, the two universities have worked together to create Ventures to spark joint entrepreneurial activities, formed a collaborative school of public health, created the Center for Health-Related Informatics and Bioimaging, advanced the Center of Excellence in Regulatory Science and Innovation, enhanced the Institute for a Healthiest Maryland, and generated new joint grant funding in the areas of health and technology. Underlying these collaborations is the belief that the two research powerhouses can accomplish more and have a greater impact on the state of Maryland by working together. In this episode of Research Matters, we look into the ongoing collaborations between these two universities and get a glimpse of what still lies ahead. This is Research Matters, Empowering the State.
Welcome to Research Matters. I'm Don Kettle, Dean of the School of Public Policy at the University of Maryland, and your host for this program today. 1 year ago, the University of Maryland College Park and the University of Maryland Baltimore joined forces to create Empowering the State, a strategy to harness the two campuses to stimulate real innovation and impact. I'm pleased to welcome our panelists to Research Matters today as we talk about the impact these initiatives will have on our state. First up is Jim Hughes, the director of Ventures, a terrific program that we'll hear more about shortly. We're also joined by Ann Wiley, a distinguished professor of geology, former provost of the University of Maryland College Park, and a member of the Empowering the State leadership team. And finally, a special welcome to my colleague Bob Gold, former dean of the School of Public Health, a national leader in public health issues, and the first joint faculty appointment under the Empower banner. Welcome to all of you today. And let me start with you. One of the things that we're excited about is a new Center on Health Information. It provides an opportunity to try to create information resources to try to drive health reform. Could you tell us a little bit about what that is and how that works?
It was one of the first initiatives that Empower looked at. And we knew there was a strong interest on the part of many research scientists and healthcare providers in Baltimore to evaluate and utilize the vast amounts of data that are generated through the practice of medicine. And we have on College Park the University of Maryland Institute for Advanced Computer Studies, which is very well equipped to help in very large data set analysis. So the two came together early on and began conversations on ways that they might work together to improve healthcare. I think in particular they're looking at using this vast amount of data to enhance what's referred to sometimes as personalized medicine. So this is a very exciting initiative, involves a lot of people, and it received even funding from a private foundation. So we're really very excited about it.
And this personalized medicine strategy, how does that work? The doctors are creating all this information every time we go in, databases are being collected, and how does it work to come together to try to improve the healthcare that's delivered to us?
Well, one example that has been used is that when you take an MRI of the brain, there's lots and lots and lots of data that are generated. And then the genetic profile of the person is also another source of vast amounts of data. So if we take those two and combine them in cases of, say, for example, Parkinson's or autism, we might better be able to understand those mechanisms and also provide therapeutics and treatment that would help the individual person and their particular manifestation of these diseases.
The information is kind of the backbone for making that happen.
Definitely.
Interesting.
It is.
And Jim, as we talk about this, can you describe to us a little bit what you see as the real economic benefits to the state of this partnership that we're building with Empowering?
Yeah, well, what we have with these two universities that combined one of the top 10 research giants within the country as far as academic institutions. And what we need to do a better job of is really bringing those ideas that are being generated through the research into the commercial sector. So what that means is collaborating with Maryland's existing technology companies, bringing our expertise, our knowledge, along with their marketing ability and their financial capabilities. But in addition, also creating new companies. From the ideas that are generated at both universities, and also by creating more entrepreneurial graduates. So increasingly, students are having entrepreneurial experiences, particularly here at College Park during their education, undergraduate, graduate, and they are going out and starting companies. Many are not even waiting until they graduate. They're doing it right here. So part of what we're doing is trying to bring the assets of the two universities together so that, as Ann was describing in the area of health informatics, you bring the expertise of both, but then engaging the business community very aggressively.
And so we're talking about not only trying to create new opportunities, but also new jobs, maybe even in new industries that are in the process of being invented.
Absolutely, yeah. So at the end of the day, yes, bringing new products to the market that are going to improve healthcare or information technology or clean energy, those types of things. But as we're doing it, also creating jobs in the state of Maryland.
Yep. With the one better than the two entities operating independently.
Absolutely, yes.
Fascinating. And Bob, one of the things we talked about early on was the idea of this new collaborative school of public health. What is this animal, and how do you see it working? What kind of benefits do you think
Well, it's really a unique opportunity for the state of Maryland. Maryland is a unique laboratory that reflects some really critical challenges. In terms of economics, one of the biggest economic drivers of the state's economy is the cost of health care. 20% of every dollar is directed at health care costs in this state. But we have a unique set of circumstances in this state. We have among the highest median household income in the state. We have the second highest number of healthcare providers per 100,000 population in the nation. We have world-class healthcare facilities. We have highest rate of African American home ownership, and yet huge disparities in morbidity and mortality in this state drive much of that healthcare cost. Now, we cannot address those issues with simply clinical approaches, and we cannot address those issues with only behavioral, social science, environmental, and policy approaches. And it's the unique opportunity to meld across those barriers that gives us a chance to design some new ways to address this issue. And in terms of the training of future public health and practicing professionals, imagine an opportunity if we remove all the barriers to cross registration between campuses. That means our students could get access to the biomedical, infectious disease, and chronic disease expertise in Baltimore, and their students can take advantage of the extensive behavioral, social science, environmental, and policy expertise on this campus in order to produce a population of practicing professionals more likely to be able to address these issues.
So what we're really trying to talk about is creating a kind of research and academic powerhouse that combines the assets of the two.
Absolutely. That really is the key. Both can operate independently, as we have been doing as accredited entities in the past. But coming together and removing the barriers to the integration of faculty, students, staff, research funding, and other strategies really affords us a new and unique opportunity in this state.
Exactly. Fascinating on this. And the healthcare piece, Ann, is an important foundation to this. But one of the things that I know that MPowering is also working on is the whole idea of regulatory science, of trying to find ways of not only combining issues on medicine, but more broadly on bringing the expertise of the academic and the scientific community together with people who are writing the regulations that affect us all.
Yes, that's true. We set up a joint center for excellence on regulatory science and innovation. This is between the College of Engineering, the A. James Clark School of Engineering, and the School of Pharmacy at the University of Maryland, Baltimore. It's funded by the FDA, and it was set up to review the way new medical devices and pharmaceuticals are reviewed and evaluated by the FDA. What the center is designed to do is really promote innovation in the design of new biomedical devices and new drugs, and in such a way that we, of course, always protect the safety of those people who are using them. We're not going to compromise that, but we want to make sure that the process is as streamlined and as effective as it can be to promote and not discourage innovation. We also will develop a master's program. It's under development in regulatory science. I think this is a foundational subject and applies broader than just the FDA, but in many areas of regulatory agencies throughout the federal government may look to us for leadership in this area.
Because what I understand is that if you look even right outside our front door here at the university, we have everything from climate regulation to food safety regulation and drug regulation and medical device regulation. And the battle always seems to be, well, we want the new stuff brought to market, but we want to make sure the public's safe. And one of the challenges, from what people tell me, is trying to find a way to find strategies for balancing that.
That's right.
And so the question is, what kind of role do you think that the university and this empowering partnership can play in trying to find some new balances on that?
Well, I think it's a very important endeavor, and I think we need basic principles on which regulatory science can rest so that we can evaluate these processes within a context of independent principles. And I think that way we can give the public assurance that their safety is being protected, but we can still bring new devices and new drugs and new approaches in industry of all sorts to the benefit of the people of the state and the nation.
I'd like to add a little bit to that. In addition to regulatory science being concerned with safety, there's also a concern for effectiveness of these therapeutic regimens. And so we want something clearly. First, safety is the issue. We want to do no harm. But we also want to ensure that products and therapeutic regimens and therapeutics that are developed are also able to do what we expect them to do.
And part of this, I guess, as well, is that if I've got a disease, if I have a condition, if there's a possible treatment out there for me, I want that brought to me as quickly as I possibly can. I want it to be safe, I want it to work, but I want access to things that might possibly enhance the quality of my life.
Yeah. The average time now for translation from basic science discovery to actual use in practice runs between 14 and 17 years.
14 to 17 years?
14 and 17 years. It's astounding how long that process really takes.
$1 billion to navigate all that distance. It's not just the time, but somebody has to invest up to $1 billion or sometimes more.
Wow.
So it's discouraging, actually. It's a discouraging process we have. It makes the idea of new drugs or new medical devices really a formidable problem. And I think that we need principles that allow us to protect safety but move more quickly and effectively in this whole area.
And Jim, what kind of prospects do you see MPowering being able to bring to this consortium of universities to be able to advance research on these questions?
Yeah. Well, it's interesting. We've focused a lot on the healthcare side of things, but just in the last couple of weeks, our School of Social Work had an opportunity to focus on some microfinancing opportunities for the less well-off in Baltimore City, and frankly, we did not have the expertise in-house. And we started looking at College Park, and the Smith School of Business as an expert in microfinancing, put the two together, and very early stages, so just getting started. But when you start looking at increasingly the role that nonprofits play and social, there's a Center for Social Value Creation, again with the Smith School, and looking how we can get the social workers, the healthcare providers, the business people, the lawyers, working together both for commercial ventures but also for more of these social enterprises. On the grant side, we're just in the last couple of years, we've really had some significant successes for a couple of reasons. The federal government is increasingly focusing on results. Increasingly, the basic research is still critical, but increasingly saying, all right, how can we direct this research to really help people? And in order to do that, they're putting together consortiums. So it's not just the work of an individual investigator. So for instance, we started a seed grant program here 4 or 5 years ago, connecting the two schools, and brought together a faculty member from our School of Medicine, somebody from the School of Engineering here. They did some great work that we funded internally on traumatic brain injury. They've now received significant funding from the federal government to take that further. We just received $2 million from the National Institutes of Health to develop a miniature robot that we hope someday will help with brain surgery. And our neurosurgeon could not have done that without an engineer, and the engineer obviously needed the neurosurgeon. So we are seeing, by bringing these groups together, there's significant funding out there.
And I want to focus on two words that you used. One was our, and the second one was we. And it's the sort of thing what I'm hearing you say is that the physicians and the medical researchers on the Baltimore campus, without partnerships with the engineers on the College Park campus, would not be able to find ways of inventing these new robots.
Absolutely not, no. So that's an idea that, leaving aside the funding, that would be an idea that maybe the surgeon would come up with on his, at the end of a surgery, saying, if only. But in the past, those ideas would just be one of those passing fancies, and now they are engaging with people who say, oh, I know a way to do that. And you're getting those types of conversations. We have a lot more of those conversations need to be had, but it's very exciting seeing what's happening.
And some of these collaborations really get down to the question, Bob, as you were talking earlier, about how to try to make people healthy and healthier. And we have a Healthiest Maryland initiative that's underway that's part of this as well.
Well, the Institute for Healthiest Maryland really started as a partnership between the State Department of Health and Mental Hygiene and the University of Maryland, Baltimore, principally the president of the University of Maryland, Baltimore, and the secretary of the Department of Health and Mental Hygiene, Joshua Sharfstein, following what was a $9.5 billion community transformation grant, which was part of the healthcare reform. They created an Institute for Healthiest Maryland, which will really focus on providing support and assistance to communities in the state of Maryland to address some of these issues at the community level, which is where so many of the solutions actually have to be developed, uniquely developed at that level. But because of our partnership and growing partnership over the last year, the University of Maryland College Park is now playing a significant role in that institute as well. And so we'll see more and more of those kinds of shared opportunities across these two campuses that may not have originated with that in mind, but are moving in that direction. And
some of this, I understand, is having impact now in Prince George's County with the new initiative between Prince George's County and with the state of Maryland?
Enormous change. If you look back over the last 10 to 15 years, what we've seen is that most of the people who live in Prince George's County who have health insurance have sought clinical care outside the county. And the people who do not have that kind of support have used the county's hospital and clinical facilities as a safety net without the ability to pay. And the county has been struggling for a number of years at huge deficits that have been borne by the state and the county. 18 months ago, we, in partnership with University of Maryland, Baltimore, University of Maryland Medical Center, and other partners, did a public health impact study in Prince George's County to say what would happen, what would be the best way to address some of these issues in health care in Prince George's County. And it is part of an effort to create what may be a $600 to $700 million effort to move parts of University of Maryland Medical Center into Prince George's County to become the central deliverer of healthcare services. But more importantly than that is the connection between the clinical services and an academic health center concept in which University of Maryland College Park would naturally become a partner as well.
And Ann, I want to ask you about the impact of this in another setting at the universities in Shady Grove, because part of this partnership is also focused on our activities there.
Yes, this is one of the earliest areas of collaboration. We have an Institute of Bioscience and Biotechnology Research that's a joint institute between College Park and Baltimore, and that was established really before all the discussions of our partnership got underway in a real way. We also are collaborating on developing our academic programs at Shady Grove. We want to essentially double the number of undergraduates that we teach there by bringing engineering and kinesiology and information studies and numbers of areas that are STEM related or that would complement the expansion of Baltimore's educational activities there. They're going to bring some of their medical education and dental education. They already have social work and nursing and pharmacy. So we will create a center of education as well as research at Shady Grove that is really a collaborative effort between the two of us.
Fascinating on this.
The other thing we're bringing to Shady Grove is also the entrepreneurial activities.
Right.
So of course there's a great technology corridor that Shady Grove is right in the center of.
So where it's located, because it's located up the Route 270 corridor.
Right on the Route 270 corridor, so you have the heart of Maryland's biotech industry and information technology industry right there. So we will very shortly have staff located there who are jointly representing both campuses through MPowering as far as technology transfer, industry collaboration. So it's going to be a real focal point of ours.
Yeah, remarkable. Well, now for the segment of the show we're calling grades. We're a university after all, and so we know we have to give grades. And the Empowering the State initiatives are now 1 year old. So I'd like to ask each of our panelists how we're doing so far on these collaborative programs. Ann, let me start with you. How do you think we're doing? What kind of grade would you give?
Well, of course, I think I'd give an A+, since I've been involved from the beginning. We have established very good, strong working relationships. We're friends. And I think we tend to think now of each other when new initiatives come along. Is this something that we could do better, more effectively, more comprehensively if the other institution is involved? So I think we're doing great, and I think we have a long future ahead, and we just have started.
That's part of the we and our piece on this. Jim.
Well, I should defer to Ann. Ann, how are we doing? But report to the steering committee. Well, yes. What's been very exciting about it is in the past when we had a success at one campus or the other, it was a success of that campus. And now it's a success for both. So when Baltimore has a win, College Park has a win. And College Park has a number of wins, just won a major grant from the National Science Foundation to create I-Cores. On the one hand, I think we're doing incredibly well. I think we've just scratched the surface. So I might be a tougher grader and give myself a B in that we've got a lot more to do.
You've got to leave yourself a little bit of room.
A little bit of room. So yes, a year from now.
The second half of the course.
Right,
maybe.
that's right, yes.
Bob, what grade would you give?
Well, I think I'll come down someplace in between Ann and Jim. I am astounded. I'm spending a lot of time on the Baltimore campus this year. Almost 70% of my time is spent on the Baltimore campus. And I am amazed at how much change there has been in the culture there in terms of acceptance of partnership with College Park around these kinds of things that we've been talking about. For that, I would give the highest grade possible. For the opportunities, I would give the highest grade possible. Perhaps for visibility on our own campus and on their campus about what is actually going on already, I would give a slightly lower grade because we still have a long way to go and a great many opportunities to make that happen.
But we've got a joint appointment between the two campuses embodied in you.
We have more than one now. Barbara Alving is also a joint appointment, and I suspect that will grow.
Sit there. But that's part of the way of building the bridge back and forth. Well, Empowering the State may be just a year old, but as you've heard, this partnership is, well, it's past crawling, it's walking, it's running. And we've heard today that we're already leveraging the strengths of both universities to attract exceptional faculty, better serve students, and to benefit our neighbors and our state. We're fundamentally changed the way we think, and and we now seek to collaborate in everything that we do. That's it for this episode of Research Matters. I'd like to thank our guests for this conversation today. I'm Don Kettle. Thanks so much for joining us. We'll see you again very soon as we bring together more of the university's top flight researchers working on problems that matter to you.